It is time for cardiovascular system review. So let's get started. First of all, we're going to go through the topics mostly in order, and we're going to start with the pulse. So what is pulse? It's rhythmic dilation of an artery. You can feel it. The most common arteries to feel and measure your pulse: carotid in your neck. That's typically only used for unconscious people. It's a little aggressive to be grabbing at someone's neck. So where is it going to be measured most of the time? Here's your forearm. Look at your hand, thumb side. Go down here, radial pulse. Okay. In diabetics and sometimes with other people, doctors are going to check a pulse in the foot just to make sure circulation is getting to the extremities. Okay, so here's a question that we struggled with. Which pulse point location is most commonly used by doctors and nurses when assessing healthy patients? We just talked about it. Do you know what it is? It's the radial pulse. Okay, remember thumb side, radial pulse. Here's another question we struggled with. Where is the ulnar artery? Well, in your forearm, thumb side is radial, pinky side is ulnar. So look at that picture, the diagram. Which one is pointing to the pinky side? That should be this one. All right, then we went through a whole lot of functions as well as an introduction and overview to the system. So we talked about functions. We talked about the cardiovascular system helps to regulate body temperature, and then it does a whole bunch of transport hormones, transports immune cells, transports gases, transports nutrients, transports waste. And if you think about it, we could kind of say that it transports heat in an attempt to regulate our body temperature. Three main parts: heart, blood vessels. The size of your heart, about the size of your fist. Okay, it's in your thorax between your second and your sixth ribs. Okay, it's tilted slightly to the left, and it makes a lub-dub sound when those valves close. Has a double membrane pericardium with serous fluid for protection, and blood has four parts: plasma, carrying all the dissolved nutrients and wastes and gases; red blood cells, carrying oxygen; white blood cells, fighting infection; and platelets help with blood clotting. There are four main blood types: A, AB, B, and O. O is the universal donor. AB is the universal recipient. There's also the Rh factor, either positive or negative. So it's either A positive or A negative, AB positive or AB negative, and so on. So what are some questions that you struggled with in this section? Which layer of the heart here represents the endocardium? So I think of it like this: endo, like indoor, the inside layer, and the myocardium, the middle layer, is labeled for you. So you just got to look where it pulls from in the diagram, and it should be A as the endocardium, the epicardium on the outside layer, and then you have that double layer pericardium with some fluid for protection. Here's another question that we struggled with, which is not a function of the cardiovascular system. And you know, it's transporting neurons. Neurons are nerve cells. The cardiovascular system is definitely not transporting those. Okay, where is your heart located? So we just talked about it. We talked about the size of the fist. Do you remember something? All right, so remember, between the second and the sixth rib in your thorax. Okay, mostly behind the sternum, although tilted slightly to the left. All right, then we talked about the heart structure itself: the septum, the wall dividing the two sides, top chambers, atria, bottom chambers, ventricles. They're thick for pumping power. The right side carries deoxygenated blood. The left side carries oxygenated blood. You have the apex of your heart tilted toward the left side. And we have valves that keep blood flowing in one direction. The atrioventricular valves closing makes the lub sound. The semilunar valves closing makes the dub sound. So here's a question you struggled with. What is the average heart rate? Do you remember? 60 to 100 beats per minute. Here's another question. What is the outermost? Okay, so not indoor, outdoor, right? So it's not endocardium, and myo is middle. So it would be, the epicardium. I think the circle's not in the right spot, but it is the epicardium. That's the outdoor layer. Here's another question we struggled with. The heart weighs just over a pound. Is that true or false? That is false. The heart weighs 250 to 350 grams, and a pound is about 450 grams. So the heart definitely weighs less than a pound. The lub-dub sound is created when valves close. Remember, open, we can open silently. Close is the sound. All right, so blood vessels and circulation. So we talked about three main blood vessels: arteries carrying blood away from the heart, and thick walls, thick muscle, that's the tunica media. You can feel a pulse in arteries. Veins go to the heart. They have the biggest lumen, less muscle, and they have valves. And then the capillaries are the tiniest blood vessels. They're the site of diffusion, and they connect the arteries and veins. And there's three main types of circulation: coronary, bringing blood to and from the heart tissue itself; pulmonary, to and from the lungs; and systemic, to and from the whole body. So it's coronary from the heart to the heart tissue, back to the heart; pulmonary from the heart to the lungs, back to the heart; systemic from the heart to the whole body, back to the heart. Okay, so you can see it's just a cycle each time. So a question we struggled with: veins carry blood to the heart. Valves and veins help to push blood back into the capillaries. False. Those valves help to push the blood back to the heart. Veins have, so which ones of these do they have? Large lumen and thin tunica media, that muscle layer. So then we did cardiac cycle. Cardiac cycle is about 0.8 seconds. It has two parts: electrical event happening first, then the muscular event. The electrical event has the SA node, which is the pacemaker, to the AV node, which is between the atria and the ventricles, and the bundle of His, which goes down the septum, and then Purkinje fibers to every muscle cell in the ventricle. And then the muscular event is the contraction. So it's based on the contraction of the ventricles. So the electrical event has to happen first. SA node, AV node, bundle of His, Purkinje fibers. SA node, AV node, bundle of His, Purkinje fibers. SA node, AV node, bundle of His, Purkinje fibers. Muscles contract. Okay. The EKG records the electrical event in the heart. So it goes P wave, and then a QRS wave, and then a T wave. P wave, QRS, T wave. Okay, and that's recording the electrical events in the heart. So here's a question we struggled with. Which of these EKGs shows tachycardia? Tachycardia, rapid heart rate. So which one is it that shows tachycardia? And as a reference, I give you a normal EKG. So it should be this one. That one shows tachycardia. Do you see C shows bradycardia? That's a slow heart rate. So what's different with arrhythmia? Do you see the spaces are not consistent? It's longer, then it's shorter. Okay, that's arrhythmia. Ventricular fibrillation is going to lead to death if it is not resolved. You can see that as a very irregular pattern. Atrial fibrillation has kind of that sawtooth in between what looks like sort of a normal QRS. Okay. All right, so then diseases and disorders. Bradycardia, talked about already, slow heart rate. Tachycardia, fast heart rate. Myocardial infarction is a heart attack. Angina pectoris is chest pain. Atherosclerosis is a fatty deposit, and arteriosclerosis is a hardening of the arteries. So remember I told you years ago to a student who said they thought of their father was fat, so ather looks like father if you put an F there. That's the fatty deposits. And then hypertension, high blood pressure; hypotension, low blood pressure. So question we struggled with: low blood pressure, again, that is hypotension. Okay. So we watched a movie, Something the Lord Made. Had Vivian Thomas and Dr. Alfred Blaylock, although Vivian does receive a doctorate at the end of the movie. It is based in Nashville, Tennessee at Vanderbilt University, and then they went to Baltimore, Maryland to Johns Hopkins. In 1930, the banks fail due to the Great Depression, and this changed the path of Vivian's life because he had been saving money and was planning to go to college. At Vanderbilt, they did research on traumatic shock and discovered a cure, which was to give transfusions. At Vanderbilt, they began researching blue baby syndrome, which results from a congenital defect called tetralogy of Fallot. They did the first blue baby operation on a little girl. Her last name was Saxon. And this was a very controversial procedure because at the time, the medical community did not believe that you should be operating on the heart. You should not touch it. Evident in this movie is a lot of racism. The relationship between them is very complicated. Although Dr. Blaylock treats Vivian as an intellectual equal, he doesn't really stand up for him in situations where he could have potentially. So, a question we struggled with, Vivian is upset. Well, he's upset because he's a class 3 worker, okay, and getting paid like a janitor, a maintenance worker. Okay, how many doctors were willing to assist in the Saxon surgery? Just 3. That's it, out of that whole class. And then we did the names of blood vessels, the aorta being the largest, artery about the size of a garden hose coming out of your heart, carotid artery and jugular vein in your neck, femoral in your thigh, brachial in your upper arm, hepatic to your liver, gastric to your stomach, radial thumb side, ulnar pinky side, thoracic in your chest, and pulmonary artery and vein going to your lungs. Remember, pulmonary artery, the one weird artery that carries deoxygenated blood because it's going away from the heart to the lungs. And then the flip side, the pulmonary vein, actually has oxygenated blood because it's going back to the heart from the lungs. So a question we struggled with, the subclavian vein. Remember, veins are typically in illustrations represented as blue in color, and subclavian runs under your clavicle. Okay, and we have one more question. Femoral artery. So again, artery in illustrations would be red. Okay, and femoral is like your femur in your thigh. Okay. So that's it. That's the end of review. Hoping you're feeling a little bit better about that cardiovascular system test. So take your time, be patient, and I know you can do well.